So what does getting Botox actually look like, and how do I know if it's being done safely and properly? I'm Dr. Abs, and I'm going to show you. This is Jo. She usually gets Botox to keep her forehead still. Now, personally, I don't think it's actually needed and should be better off with other treatments instead, like LED therapy or a laser or something to improve skin quality as opposed to just stopping the skin moving. But I have no right whatsoever to control what she does, and it's always the patient's choice. This is how we do it. First, we find a target muscle, then we work out our injection points, and then we work out the depth of those injection points by looking at the anatomical layers. After we've got all that, we carry out the treatment. When we raise our eyebrows and scrunch up our forehead to look surprised, the muscle we use is called the frontalis. She wants to stop this movement, which means this is our target muscle. The next job is finding where on the skin we actually place our needle. We ideally want to freeze a significant portion of the muscle. However, there's a fine balance. If you inject too low and too close to the eyebrows, there's a risk of them dropping. If you inject too high, then you might not get the belly of the muscle and achieve any effect at all. So in this case, we're going to leave a gap to the eyebrows to be safe and a gap to the hairline so we have a decent effect. We're aiming for roughly the middle third of the forehead muscle. A word of warning here though, the older you are or the lower your skin quality, the bigger you need to make that gap to the eyebrows. In other words, the worse your skin is, the higher the risk of your eyebrows dropping, so you need more of a safety margin away from them when you inject. Now there are other risks too, but I think it would just make the video far too long to go through all of them. If you'd like me to make a video specifically about the risks of forehead Botox, comment down below and let me know. Roughly speaking, around 5 injections on the forehead are usually enough as an average. Sometimes you do need more or less, but that's based on the individual being treated. We're going to start with the middle. There's no eyebrow underneath here, so there's no risk of any eyebrow dropping. Then we're going to try and find somewhere on the mid-left and the mid-right area for the second and third points. I'm working out where the majority of the muscular activity is by asking her to move and then deciding somewhere roughly there between the center point and the edges of the muscle. I also want the edges relaxed too though, because if you don't do this, the sides of the muscle overwork to compensate for the middle of the muscle turning off, and you get these ladder lines as well as high eyebrow peaks, sometimes called spot brow. This is called botulinum rebalancing. Botulinum just refers to botulinum toxin, which is the active ingredient in the brand name Botox. It's where one area works harder because a nearby area has been turned off. In fact, it's actually one of the ways in which Botox might give you wrinkles instead of taking them away. Think of it as 2 people at work. One leaves the office early, but there's still work to finish off. So now 2 has to do their own work, i.e. lifting the part of the forehead that they normally lift, but also one's work too, i.e. lifting areas around them as well. It's extremely important to understand, and it's why I rarely ever recommend Botox for cosmetic reasons. If you're interested in seeing a video specifically and exactly explaining how Botox can give you wrinkles instead of taking them away, let me know in the comments below and we'll see what we can do. But for now, we have our main injection points. We've decided to inject along the middle third. We've chosen to go right in the middle, towards the edges to avoid ladder lines and spot brow, and finally somewhere right in between those so we have a significant portion of the muscle. We've got the majority of it covered, and we've stayed away from risky areas to avoid things like eyebrows dropping. These 5 points give us our 2-dimensional plan, so now we figure out how deep to inject and develop our 3-dimensional plan. The depth of the forehead muscle tells us how deep to inject in order to reach it. There's a few different layers in the region, as you can see. Skin, fat, muscle and bone are the main points of interest for the purposes of today. This depth and thickness tells us that essentially, if we pinch the skin, we'll have some of the muscle between our fingers. Plus, we can go relatively deep if we want to, because the muscle is basically right on top of the bone. Now, we can take a step back and check our plan. We have the target muscle identified, the 2- and 3-dimensional injection points, so we're ready to carry out the treatment. Take a look. Each time I'm pinching the area with my fingers to grab the muscle in between them, just like we planned using our knowledge of the area's anatomy. Then I'm going to place the needle carefully into that pinched area and go relatively deep to make sure I'm in the heart of the muscle. This entire process is pain-free. I've used no numbing cream or anesthetic of any kind, and as you can see, Jo had no pain at any point. As a side note, the markings I drew onto the skin today can introduce bacteria into the body if you inject directly through them, so I made sure my needle needle was slightly to the side. So quick disclaimer here before we go any further. If I treat you in clinic, you'll never see me draw these markings. They were done here purely for educational purposes in this video. In terms of blood, you can see that there was barely any. This is because I didn't hit any blood vessels when I injected. It's not too easy to see on camera, but in person I tried to see the blood vessels through the skin and purposely avoid them. It's not always possible though, and if it does happen, a bruise is nothing to worry about, so stay calm if you get one.
Everybody stay calm!
What's the procedure, everyone? What's the procedure?
Stay calm!
Wait.
Everybody calm down!
Now you've seen the whole process from planning to execution, there's 3 things to know if you're thinking of getting it yourself. 1, the way I've done it here isn't the only way. If you have it done slightly differently, there's nothing to worry about. In medicine, multiple opinions doesn't mean that only one is right. Sometimes we inject in a flat line, a W, an M, a V, or something entirely different. The treatment should be as individual as you are. 2, never get things done simply at the cheapest price you can find. It's literally your face on the line. It's your physical identity on the line. There's plenty of examples of people ending up with botched faces simply because they prioritize price over quality. You should always aim to be safe first and foremost, and then worry about everything else afterwards. Number 3, and this is the most important, so listen carefully. Stopping your skin from moving isn't anti-aging. That's why your wrinkles still come back after the toxin wears off, which clearly means Botox isn't preventive, by the way. It's also why I never, ever recommend Botox for anti-aging purposes. You're better off with things like LED therapy or lasers or microneedling or something else which can actually grow your skin and optimize cell function, i.e. skin function, as opposed to just freezing you. In fact, Botox can actually reduce cell function and therefore skin function, and we have great scientific evidence for it too. If you'd like me to show you that and go through it, let me know in the comments below. Now that you've seen Botox being injected, if you'd like to see fillers injected too, such as in the lips, click on the next video now. Otherwise, thanks for watching and check out my Instagram if you want more.